I'm not going to take much of a time, and I would like to thank organizers and the instructor. दिसत नाही हा इथे. Thanks for accommodating. I'll take 2 minutes. Yeah. And my talk is on changing trends in surgical training. No financial interest in any of the technologies which I'm going to mention. When we all started as a resident, like Vavikar and myself are contemporaries. 5 minutes, yeah. I'll finish in 5 minutes. Yeah, no problem. Yeah. So Dr. Vavikar and myself were, yeah, good. Thank you. So Dr. Vavikar and myself are contemporaries, and Sandeep is our senior, about 6 years senior to us. No, you are young. And at that time, the principle of surgical training was Halstead's principle of surgical training. So what is meant by that? That residents must have intense and repetitive opportunity. And we had that intense and repetitive opportunity. The volume of the OPD used to be very high. And we used to have OPD right from 8 o'clock till 4 o'clock without any break. So we had that intense and repeated opportunity to take care of surgical patients under supervision of skilled teachers. So who were our teachers? So I can ask Dr. Nagavekar, like seniors were our teachers. When we were junior resident, 2 years senior, he used to teach us. Because there were more of a honorary system rather than a full-timer system. And they were taught by their seniors, and they were taught by their seniors. So those seniors had become honoraries. So that's how we learned. But the thing was that we had an opportunity to see many patients, and it was more of a self-learning type. The second thing was that wet labs. In those days, there were hardly wet labs. We used to go to butchers and take goat size and pig size, you must be remembering. And whatever sutures were remaining, we used to catch hold of those sutures and then we used to try. There were no microscopes when we started. And I think the first surgery what we did was intracapsular cataract, cryo extraction with broad iridectomy. Probably Dr. Nagavekar must have done the knife section. But yeah, he must have started with knife section. And that is how now he is an expert phacosurgeon and a flak surgeon. So it's a learning process for everybody throughout. But for students nowadays, it's advantages. Now what is the advantage? Nowadays, we are talking of 3D printing. 3D printing technology, like you can print corneas and train the students, like at LV Prasad, they are already doing it. So see the difference. We used to go for and take goat size, pig size, try to learn on our own without microscope. In fact, we have done surgeries without microscope and used 10-0 suture also. So how we used to see, I don't know, God is great probably. But the new students have good access to technology. Second thing is for references. For doing PG thesis, you must be remembering what references we used to get. We used to go to some library, we used to ask our bosses whether you have any books, then they may give you those references. Or we used to visit conferences. There were hardly any conferences. I remember that there used to be only one good conference at Dr. Nagpal's place. Dr. Bhavishi and Nagpal, they used to have a conference. That's how we started learning. But in 1990s, there was advances in instrumentation, advances in surgical instruments, microscopes. In fact, when we were students, we had no access to microscope. Our bosses, there was only one microscope in our college. Our boss never used to allow us to operate under that microscope. So what we did was 3-4 of us pooled money, went for AIOS, purchased one Jaggi microscope, and kept that microscope in the operation theater, and we used to learn on that. But nowadays, these students have access to any equipment. The microscope with teaching scopes are there, the videos are there. And then came the era of internet, and it just opened the Pandora's box. 5G technology and connectivity has changed everything. So nowadays there are video assisted skill transfers. You need not attend any conference. You have huge number of videos which are available on YouTube channels of surgeons across the globe. You can go to the video channel of David Chang, see his videos. topmost surgeons from the world, students have access. So go to those videos, learn from them. Last 2 years, COVID has halted everything. Nothing was there. But then the other side, for teaching, it was a boon. There were so many webinars which were going on. And we could ask surgeons all across globe, like for Maharashtra Ophthalmological Society, we took help of Steve Arshinov, and he came and he delivered a lecture during our MOSCON. So from one side he was talking, and from other side Ronald Yu was the speaker. So that was an advantage, webinars. Then Orbis has come out with a cyber site. Cyber site lectures are always there and very interesting, and expert speakers all across globe, they teach you. So take help of those cyber site. For the surgeons who are not privileged, like African surgeons or Latin American surgeons, there is a project Orbis, which is a flying eye hospital. So surgeons from all across the globe, they travel to that particular country. There is a lecture room inside the aeroplane. There is an operation theater inside the aeroplane. The live surgery is relayed, and there is a direct question and answer session with the surgeon, and that is how it is taught. Another important advantage for newcomers is that simulator-based training. There is a stall by Help Me See. So they have come out with the simulation-based training for manual small incision cataract surgery. Initially, there used to be only few steps of simulation training. Now they have come out with complications of M6 also, and now they are coming with simulation for phacoemulsification also. And in fact, a study was conducted with the Help Me See and LV Prasad Eye Hospital. The students were exposed to simulator training, and then they were exposed to surgery, and their skill was far better than those students who were not priorly exposed to simulation training. So I think for newcomers, sky is the horizon. You have so many of the conferences. There are SSTC, TSTC, DSTC stalls are there. You can go there, have hands-on training. So all in all, as compared to 30 years ago or 40 years ago, what we were exposed, nowadays students have lot of exposure to new technology, and they should utilize it to the fullest extent, and so that they become a better surgeon. Thank you. And I would like to thank again AIOS for the opportunity. Thank you.